So Dr. Jones, you can go ahead and start.
Thank you, Handy. I appreciate it. I don't have a problem if you've got questions throughout there. This little short presentation, it's just about making sure that you've gone to all the trouble of getting those cows pregnant, getting them bred, and getting them set up so that they calve within this window so that you can put them together with that other cattle and sell that truckload. And it's awful discouraging, you know, when you go out there and we get out there and there's a dead calf. Is there something that we could have done to save that calf? And so I'm going to talk a little bit about some simple things that we can do. And a few years ago, we used the Georgia Beef Commodity Commission that gave us a grant to go buy this, what we call a calving simulator model. And you take it to the different farms or field days or extension programs, and you set it up on a table, and it's just a big plastic cow that's got a lid that you can take off, and it's got a rubber calf inside that you can set in all kinds of positions, and people learn how to correctly pull a calf. And so it's it's a cool training program if you guys want to do that. If you've been a little leery of examining a cow that's having difficulty calving, I hope after this that you're at least willing to give it a try and feel around in there, maybe get a calf pulled successfully. But the main take-home points I want to leave you with are body condition score. That's huge. Timely intervention and clean examination. And so manure is a great fertilizer, but it doesn't belong in that part of the cow. Lots of lubrication, because it's very important. I mean, naturally, when a calf is born, when any baby's born, it comes out with the birth fluids, which is very slick. And then the colostrum for calves, and that's huge on that calf health. So Dystocia is just a scientific term for calving difficulty, and it definitely occurs most often in heifers. Many years ago, when I got out of vet school, it was not unusual for 1 in every 5 heifers to have difficulty calving. Nowadays, it's probably maybe a lot less than 1 out of 10. But the most common cause is that the calf is just too big to go through that birth canal easily. And there are other causes. The calf could be in the incorrect position, could be coming tail first, or a leg back, or a head back, a lot of different things. And I've corrected a lot of these over the years. Could be twins or something abnormal with the fetus, a congenital defect, something like that. With the cow, there could be some incomplete dilation, uterine torsion. The last C-section that I had to do on my own cow, my own farm, was because the reproductive tract was twisted over. And so she wasn't able to deliver that. And then something called uterine inertia, and that's where the smooth muscle contractions in the reproductive tract just really can't push this out. And that typically is because of a nutrition problem. Specifically, it could also be because of low calcium. The calcium levels in the forages are just not adequate, and then maybe the cow doesn't have access to good mineral. So when you look at the USDA, the National Animal Health Monitoring Survey, and this was kind of very typical of Georgia herds, mostly small herds, but the majority, and even my own small. I heard several of you talking about your cow herds, and I have 19 mama cows and 1 heifer, 1 bred heifer. So I'm in that same group of altogether. I've got about 50 some odd heads, some calves on feed and some replacement heifers and some pairs. So I fall into the same category of small time farmers, and I've got a day job. I work for the University of Georgia, so I'm not out there full time. I'm not a full-time cattleman. But anyway, when you look at some of the causes of calving problems, believe it or not having a defined season means that we just don't give supervision like we could. And then many people, they just don't see that animal out there having difficulties, so we don't get intervened or assistance in a timely manner, and then we end up with a dead calf. Again, some of the risks: a long calving season. Dr. Noble talked about the benefits of having a defined calving season for marketing, and that's huge, especially if you're going to combine calves with other people. Many of us don't have help. We can't afford. We don't, there's just not enough money to hire somebody to go out there and do some of those things. So it really is up to us when we get home early in the morning. Sire selection is very important. We want to make sure that we don't have bulls that are going to throw great big calves, especially in our heifers. An older cow can handle a larger calf, but as one farmer said one time, says, "Doc, I'd rather go count calves than pull calves." And what he meant by that is he'd much rather have a small calf born healthy and vigorous and running around. And so all he's got to do is go out there and count them, and he doesn't have to worry about it. And I totally get that as somebody that has a full-time job too. So what are some of the effects of calving problems? Well, obviously a dead calf. That's certainly obvious. But calves that are born alive but had a difficult, they're at a lot of risk. One of the very first things that they don't do naturally is actually get up and take colostrum, their first milk. And, that's their design, their immune system. That's the way they are designed by God, to get up and nurse that colostrum, because it does so much good for them as far as their immunity. And so if they don't get that colostrum right off the bat, then there's going to be other risks. They're going to be at risk for scours or pneumonia or something like that. And calves that don't get colostrum are at 3 to 4 times higher risk of dying from disease before weaning. And so you look down here at this chart, when that calf gets colostrum right at about shortly after birth, you can see the protein levels in the serum are very, very high. 4 hours, really not that much difference. There is some difference with 8, but if it gets out there to over half a day after that calf's born, when it gets its first colostrum, you can see where the total protein levels drop off significantly. And calves really below this cutoff threshold here, where my pointer is, are at a high risk for developing scours, especially in this kind of muddy, cold weather. So timely intervention saves calves and cows, as well as cow fertility, because if that calf stays in the reproductive tract long time while it's trying to be born, it actually can cause damage and infection and reduce that cow's fertility. So it's really important that we provide assistance if we see that she's in trouble. And we really want to make sure that we provide assistance within 2 hours. Now, I mentioned most of us have a day job, and so that we really don't know when those animals go into labor. So sometimes when we get home in the afternoon, if we notice that a cow's off by itself or a heifer, we might want to go inspect and see what's going on. And if there's a hoof showing or a water bag or something of that nature, try to get her up into the barn, into the chute, or into some kind of restraint, safe restraint, so that we can do an examination. And I'll go through how to do that. We want to make sure our equipment is adequate and we've got really good technique, and that includes hygiene, because we don't want to introduce any bacteria or any foreign matter into that cow's reproductive tract. So the best way to prevent this, of course, is good heifer development, and then sire selection and adequate nutrition. Nutrition goes right along with heifer development, but we also want to do heifer selection. And we want to make sure that we're picking heifers that are going to have a decent enough frame where they should be able to deliver a calf and not have problems. We don't want to develop too big a cows, because they become very inefficient. But at the same time, we want to have a nice selection window or margin where we can eliminate the cows that are too big and the heifers that are going to be too small, and then use a calving ease bull. And I'll talk a little bit about that as far as the EPDs, and then adequate nutrition. And I can't harp on that enough, because we want those heifers to calve early at 24 months of age, and we want them to stay early in our controlled season. We don't want them to come up open. So this is an EPD table on a bull, just as an example. And this CED is called Calving Ease Direct. What we would like to see on that is a double digit, a positive number. Positive on Calving Ease Direct is good. You think, well, positive on birth weight is bad. Well, positive on Calving Ease Direct is good. 0 or negative on birth weight, is going to have a smaller size calf. Now, we don't want to go too small, especially in cold weather, but if we have a double-digit calving yeast direct and something around 0, could be a little bit plus. I mean, we don't want to get much over 1, but if you have a number on that bull, then, and this bull actually has a positive 100 on yearling weight and a plus 54 on weaning weight. So you probably aren't going to give up too much on weaning weight on this bull. You'll also be able to get a small calf that's born relatively easy, even in heifers. So this is a good bull to use on heifers. Accuracy matters, and then the number underneath that, you can see this is 0.96. And so there's been enough data on the calves that are born, so the accuracy is pretty high. And this is 0.98. That's about as good accuracy as you can even ask for. So cows that are a little more mature can handle bulls with a larger birth weight, but again, you might be in a situation where you would rather count calves than pull calves. I'm sure William Shakespeare was not talking about calving when he made this quote, but it is very relevant to what we're doing. It's better to be too early than 1 minute too late. So when that calf's heart stops beating, we're not going to be able to resuscitate it. So if you have any doubt whatsoever, go ahead and put a sleeve on, make an examination, and then you might be able. And I've taught plenty of farmers through delivering a calf over the phone. Somebody has held the phone up to their ear and their mouth, and they've been describing to me what they feel, and I tell them what to do. Now, most of those farmers are my clients, and so I know them, and we have a pretty good relationship, and I know what they can and can't do. But this is something that anybody can learn. And as I was talking to Handy earlier today, I said, you know where experience comes from, right? You just have to go try. So some of the preparation is prevention and, of course, body condition. People have talked about this chart here. People have talked about, well, I'm going to restrict the feed to my cows and I get low birth weight calves. There's some truth to that, but the downside is that restricted nutrition also makes weak calves and weak mamas. And so we need to make sure that we're feeding them adequately in an adequate ration so that when she does go into labor, that cow's got enough energy to push that calf out and not have a prolapse. And when that calf is born, especially if he's born in cool weather or cold, wet weather, cold, wet is far worse than snow on the ground or ice. But so if that calf's born in cold weather, he doesn't get chilled and he gets up and he nurses colostrum. So restricting nutrition can actually have the opposite effect of what we're trying to accomplish. And so we want to make sure we don't want to overfeed for sure, but we want to make sure that we're feeding them adequately so they don't lose body condition. They produce colostrum, and then those calves are real vigorous. I'll talk a little bit about cow herd vaccinations here in a few minutes with a handy spreadsheet and his roadmap, and I think that's a super learning tool. A calving area, yes, I know cleaning dry. I don't mean to be a comedian, and I understand it right now. It's not clean and dry at my place either. Scours does typically impact the later born calves. Most of the time, and that's because the scours pathogens, the bugs build up in the calving area. And so if you're developing scours, ideally what you would want to do is move the cows that have not calved over into a fresh area where there's less scours bugs to cause scours and expose those brand new calves. So some of the stages of labor, the very first stage is that the cow really moves off by herself. She likes her privacy at calving time, so she's going to move off in a remote part of the pasture. And so when you're going out, get home from work and you go out and you feed, if you had 12 cows in that pasture and one's missing, she's probably going to be calving if it's that time of the season. And so would pay to go walk down there. Most of the time I get home after dark, so I've got to walk around with a flashlight and find that cow. And hopefully she's already had that calf and she's already licked him dry. So the stage 2 is when they deliver the calf, and stage 3 is the fetal membranes, the afterbirth. And that may take a couple hours. It might take half a day. but typically that's going to go ahead and be delivered within a few hours after birth. If we don't see any progress within a couple of hours, we want to make sure that we go ahead and do the examination, and I'll talk a little bit about what that is entailed in that. But if you see, this calf has a leg back. And so I'll never forget the very first calf that I had to deliver like this. I killed it because I pulled this calf without correcting that leg. I didn't know any better. And I got panicky, and I went ahead and tried to pull the calf, and he didn't survive. So the next one, I was on a ranch in Texas, cowboying in those days. And so I called the veterinarian, and the veterinarian, who was about an hour away, he said, "I'm not coming. You can pull this one." I was like, so he instructed me on what to do. So what I did was I reached down with my arm, and I found that shoulder, and I worked my hand down, and I got to about that joint right there, and then I pulled that up. And once I got that part up, then I reached down and I actually grabbed the hoof, and then I pulled that on into the birth canal. And then I hooked the chains onto the calf, and the calf came right out. So I learned from the very first one that I did wrong, and I've not made that mistake since. These other calves that are out of position, it takes a bit more experience. But again, the only way to get experience is to jump in there and try. And so, or find a neighbor, find somebody that's got some experience that's willing to teach you. Or if you know a veterinarian, make sure that you have that number handy. It's really important to know when not to pull. And sometimes that calf needs to be repositioned. If the head's back or anything like that, you want to make sure you get because the calf is supposed to come in this right here. So down in the bottom right-hand corner, you can see where a calf is supposed to, the two front legs and then the head, and that kind of forms a wedge. And that's how the calf's supposed to be delivered in that way. So when we do the examination, we want to have proper restraint, thus both for her safety and mine and yours. And then we want to be very, very gentle. We don't want to add any stress to this experience any more than there's already there. We want to clean her up. We want to get some clean water and a little bit of soap. Dawn or Ivory is best. And just a little bit of soap. Clean up that area there where the birth canal is, and then dry it off a little bit if you can, or just kind of wipe it dry and remove most of the material. I like to take a palpation sleeve and actually cover the tail, so you can wrap that sleeve inside that, wrap the tail inside that sleeve. And then lots and lots of lube. So they sell lube by the gallon at farm supply store, and a lot of lube, water-soluble lube. We don't want to use any oil-based lubricants or anything like that, and would rather not use soap, because a lot of that toxic or harsh material going into the reproductive tract could cause some problems. But a lot of lube. So you also can have when you're in there examining, if you've got a lot of fluid, that means that you were early in the process, and that's a very good sign. If you get inside and she's really dry, that means that she's been doing this for quite a while. They're going to run out of birth fluid within about 3 to 4 hours. So if you get in there and she doesn't have any birth fluid, then you know that she's been at it for quite a while. And then that calf is beginning to get critical. And if the calf is still alive, you want to go ahead and carefully, but you want to move as quick as possible. But if the calf is dead, obviously it might be just as well to put them in a trailer and take her to some, like down in South Georgia, in Tifton, Georgia, where I am, we have a haul-in facility where we can actually do calving, assist people. If all they've got to do is put it on a trailer and then bring it to our facility, we can unload it, put it in a chute, deliver the calf. And if the calf is still alive, we would give it colostrum, put the mama in the trailer and the calf back on the trailer, and the owner can take it home. We've done that quite a few times. Gently examine with sleeves on to see if the calf's in a normal position and identify what's wrong. If it's really big, probably going to have to do a C-section. And in that case, that's something that the University of Georgia College of Veterinary Medicine or some other veterinarians will do. The picture on the top right is that cow that I mentioned that had the twisted reproductive tract. She wasn't going to be able to deliver that calf, so I went ahead and did a C-section. And that cow bred back. She had several calves after that. So just because we have to do a C-section doesn't mean it'll be infertility. It's just a show how to put the chains on a calf's leg. And I like to use chains rather than straps. They tend to be actually, believe it or not, even though they're cold and hard, chains are more gentle than straps. And I see less damage with chains. But what I like to do, if I can maybe use my hand here, is I'll put a chain over this part right above the fetlock, put a half hitch, and then put the other chain. So I double chain it so that I can gently pull, and I spread that pressure out over that foot. But that's something that we do training in our calving programs. But if you just Google this calf pull chains, this video with Dr. Selt from Oklahoma will actually show up. So complications. This is a uterine prolapse. It's an emergency that has to be replaced quickly. You don't have to cull this cow. This is the complication of calving. And then you can see this fracture. This person actually pulled this calf with an ATV. I believe that an internal combustion engine has no place in calving assistance whatsoever. Basically, that means I don't use a tractor, I don't use a truck, I don't use my four-wheeler gate or anything like that. I only use a chain and sometimes a calf jack. So lots of lube. Make sure you twist that calf, and then hopefully he won't get hip locked. Calf survival, I want to make sure that I either give that calf natural colostrum from its mother or store-bought colostrum. And typically colostrum replacer is better than colostrum supplement because it's got twice as much of IgG in it. And so I want to make sure that calf gets that. Hopefully he'll suck a bottle. If not, then we use a tube to pass it down his esophagus into his stomach. This is just kind of a handy rule of thumb, like a checkpoint at 0 to 2 hours. If the calf stands and is vigorously nursing, I don't need to do anything. But if the calf is not nursed within a few hours, then I'm going to intervene. And so I might use colostrum replacement or supplement, and then hopefully that's fine. If not, then I might have to provide a bit more TLC into that calf. So just a quick story. I was at a farm, and they had pulled a calf early that morning, and this was later in the afternoon, and the calf had not moved at all that day. And so I asked them if they knew the calf had gotten colostrum. They said no. They happened to have a bag of store-bought colostrum. So we mixed that bag of colostrum up. I tubed the calf, and he got about a half gallon of colostrum. The calf was kind of, use the word, just really sluggish and not very with it. But it was an hour drive back to the office from this farm. And by the time I got back, the owner was sending pictures of the calf. The calf had already responded to the colostrum, was jumping around and nursing his mom. So that colostrum really is, it's excellent stuff, and calves will respond to getting that.
They have the colostrum there. They have the regular colostrum and the medicated. When do we use the medicated? When should we use the medicated one?
So, I usually do not use medicated at all. It's neomycin is what's in the medication, and neomycin in the medicated milk replacer and colostrum has a very narrow spectrum of activity. And one of the things that I don't like about medicated things in the calf gut is it will interfere with establishing the rumen microflora if you're not careful. If you overdo it, a lot of people will give a calf a lot of boluses and that kind of thing. We want to be very careful because we can actually change the rumen microflora. So if a calf has scours, you can use a medicated if it's an E. coli scours. Typically, I like to use one of the injectables personally. But I stay away from most of the medicated. Now, the other medication that might be in there is called a Coccidiostat. And so sometimes that's very, very helpful. That can stop that calf from developing coccidia. Depends on the medication that you're talking about, because not all the medications are the same. And some of them Some of them, frankly, just aren't that effective. And then as far as the equipment, this is just a calf puller. Like I said, clean chains, handles, you can find those. A bucket with a little bit of disinfectant. I like the blue solution novel sand, and it doesn't, you need it to be 100%. You dilute it out in water. A little bit of mild soap. Ivory works really, really good. Lube. I like to buy lube. I buy the gallon. Sleeves, they're really critical, not just for your protection, but the cow's protection, because the cow can get bacteria from us just as easily. And even though brucellosis is not in Georgia anymore, it used to be, and that was definitely a zoonotic disease. In other words, human beings could be infected. We can still get lepto, and people have developed leptospirosis from cows, so that does happen. If there's any tags, I've mentioned vaccine. We'll talk a little bit about that. I do like to give 7-way at birth, or within the first week myself. Tube feeder to provide that colostrum, either with a bottle or if you need to pass it. And again, that's a spotlight for finding cows at night, and a good clean puller. Most of the time, you can pull with calving used bulls. Most of the time, we can pull those calves with just chains and handles. We don't need a puller. And then the facilities, they don't have to be anything fancy, but we do need something to provide adequate restraint, like an alleyway and hopefully a head gate. I'm just going to reiterate these 5 points, and take-home points: body condition, timely intervention, and in clean examination. Lots and lots of lubrication. I cannot overemphasize that, especially if she's late in the process, because we can damage tissue by trying to pull a calf through a dry birth canal. And then colostrum for those calves. I can tell you, in my own situation, and this calf right here was the calf that did by C-section, and I did give him colostrum. But in my own situation, any calf that I give colostrum, and that's not milk replacer, but colostrum, I haven't lost on my farm. So, are there any questions on that before we move into Handy's roadmap?
Yes, Doctor. I have one question for you. Yes, what caused prolapse?
Great question. 2 things. So one, there's 2 kinds of prolapses. One's a vaginal prolapse, and one is that prolapse that I showed in that picture. And so a vaginal prolapse is really just a stretched reproductive tract. A vaginal prolapse is actually a good reason to cull a cow, because that will recur. But now the uterine prolapse, which is basically what some farmers will call the calf bed or the womb, the uterus, when that prolapses, one of the reasons for that is that uterine inertia I was talking about. And what happens is that cow, the smooth muscles of the reproductive tract don't function like they're supposed to, and expel that calf. And those contractions, that's the contraction of the reproductive tract trying to push the calf out. If they're not effective, then that cow will begin to use an abdominal push, and she'll push with her diaphragm and her abdominal muscles, and that will push the calf out, but it will also push out anything else that's in the way. And so when that reproductive tract gets in there, and she has in the birth canal, and she gives a big abdominal push because her reproductive tract has basically gotten fatigued, then out comes the reproductive tract. And that's an emergency, because these cows can't survive that situation for very many hours. And so that has to be replaced immediately. And it's a very large organ. I mean, it'll fill up a 5-gallon bucket. So you'll know the difference between a vaginal prolapse and a uterine prolapse. And the uterine prolapse, once it's corrected, that cow typically will be fine. If she breeds back, it shouldn't happen again, because we feel like the causes are low calcium and poor nutrition. Any other questions?
When you put it back in, do you have to use like a suture or something on the? I know there was someone using. I was listening to someone today using like sugar to rub it to make it soft, and so they can put it inside, insert it back in.
Very good point. Thank you. Yeah, so people have used brown sugar, and brown sugar will absorb a lot of the swelling, a lot of the fluid, and then it will shrink some. And then, yes, and then once you get it replaced, then you reach in and make sure, because it's basically inside out. You have to make sure that it goes back, right in the right position. And then, yeah, we do use what's called a Buhner stitch. It's a very long 8-inch needle and some suture material that really looks like a shoelace. It's a cotton, very, very thick suture material. And we will put what's called a purse string suture around the reproductive tract. And all that does is it keeps her from pushing that out until all the inflammation and swelling goes out of the reproductive tract. And then then that irritation is gone, she quits pushing, and then it shrinks back into place. And then usually within a couple of weeks, you can just remove that stitch and everything is fine.
Would you speak for age? Because I understand that most of the problems, well, I guess you never know when you're going to have problems, but I understand all of the health and feeding them and making them healthy so they can have healthy babies and their systems are healthy. But from a 24-month-old cow to what age does age ever have anything to play with it when they have problems calving?
That we really don't know when she's going to have problems. Most of the time, the big things that I worry about with age, and when I talk about preg checking, I recommend people also look at a cow's teeth. And there's two things that are really important when we're looking at age, and that is whether or not she's developing lameness. If she's developed any kind of lameness issues, then it's probably time to send her down the road, because at some point in time, it could be during calving, that she develops an injury and can't get up. And then her teeth. And if she doesn't have good teeth, then she won't be able to graze. She won't be able to get good nutrition. And that's going to hasten her exiting from the herd, or probably injury, and then have to be euthanized on the farm, and she won't be able to sold. So body condition is another strong indicator, and that's something so body condition, lameness, and teeth are three things that as cows develop age, and usually a cow with pretty decent nutrition can stay in the herd 9 or 10 years old. I actually do have one cow in my own herd who's 15 and coming with her last calf this year. It's going to be her last calf because she's starting to lose body condition and be a little harder to keep. And so this will be her last year, but she's healthy enough. She should be able to raise this calf. But that's important. And it's also very important as a cow gets older, when she does calve, make sure that she does have milk. Because some cows, their udder, it looks like they might have milk, but in fact, they're not producing very much milk at all, and they'll actually starve that calf. So make sure just to watch that calf and make sure that he's actually getting milk and he's growing well, because if he's not, then you probably need to make a decision about culling her and either bottle feeding the calf or finding a nurse cow or giving him some creep feed. So good question, because that's important to be able to find. We want to keep these cows for their productive life, but when we keep them beyond that, then it does cause problems. So that's a great question.
Thank you, sir.
Thank you. Okay, so I want to start over here on the left, and as Handy and I were talking about this today, I do want to point out. So we've got three categories. We got our cow herd, we got our calves, and with the calves are broken down into replacement heifers and our market cattle. And our market cattle can be steers and heifers. but I want you to see that we really treat both groups pretty much the same, and at weaning is kind of where they split and had different direction. And then we've got some information about how to handle our bulls over here on the right. And I pretty much vaccinate the bulls pretty much same as the cow herd, and we'll talk a little bit just briefly about the bulls. But what I want to talk about the cows. So if we're dealing with some farmers that maybe have had a hit or miss, an inconsistent vaccination program, we're really limited. If you look at vaccines, and I do try to follow label instructions as much as possible, we only deviate in certain situations, and I'll talk about that very, very briefly. But what we want to do is we want to follow the vaccines that have been studied, and their effectiveness has been researched, and so the recommendations on the label are the best way to, as far as getting the most effectiveness out of our vaccines. So if we've had an inconsistent vaccination program, we're kind of limited on the kind of vaccines that we can use. And so we're going to be using what's called a killed virus vaccine. So virus vaccines come in killed or modified live, or some combination thereof, like as in Cattle Masters, really a combination, but we treat it like it's a killed virus vaccine. So the killed vaccines are safe. They are pretty effective if you give them correctly. And the way to give a vaccine, a killed vaccine, is that they are required to be given with one dose, and then 3 to 4 weeks later, you give a second dose. So the initial dose plus the booster. Just like when we got I got my COVID vaccine. 4 weeks later, I got my booster. So the exact same thing with killed vaccine. That does a pretty decent job of stimulating immunity. If you don't give that second dose within that first month, then the vaccine response is not going to be as effective. And if you've only given one dose every year and that's all, probably don't have the protection that you were kind of hoping for. So, but again, because we're concerned about the pregnancy and the modified live virus causing abortions in late bred cows, we can't use modified lives in pregnant cows. And we really need to avoid using modified lives in the calves if those cows have never seen the modified live before in their life. So we have some concerns there, but we want to use the killed products, use them according to label, and then use an annual vaccination program. As far as the nutrition program, obviously we're going to monitor body condition. Multi-min, I know some of you enjoy multi-min, and I use multi-min in my own cow herd. And then at preg check time, that's when we're looking at the cow's body condition, might be looking at frame score, age, teeth. I mentioned that as Mr. Greenlee brought up about aging, checking cows and making sure maybe that we get them out of the herd before they have any problems. And this is a great time to make an assessment. And I've worked with a couple of people probably on here, and we're looking at their cows and looking at the teeth. And we've made some recommendations that this might be the last year that cow stays in the herd. So we want to go and be able to market her when she's in good body condition, and we get the best return on that. So always we want to make sure we have adequate loose mineral out there. And then a quality product. Deworming, because of parasite resistance, I don't recommend routinely deworming cows that are in good body condition. And cows, especially mature cows, 5 and 6 years of age, will develop some resistance. And it's been my experience of doing fecal egg testing on adult cows that I find very few parasites in adult cows. So it's really probably wise not to deworm, because the worms that might be in an adult cow are actually going to be what we call refugia. And it's the same concept as in deworming sheep and goats. And we want there to be a source of worms that are actually responsive to our dewormers. Now, I do routinely deworm young stock, But when it comes to the adult cows, if she's in a really good body condition, then we don't necessarily need to deworm. But if we have adult cows that have worms, then I might want to check my stocking rate and I want to check my nutrition, because typically adult cows have some built up resistance to internal parasites. So what I do, and I did mention this before, 7-way blackleg. And yeah, I do recommend this within the first week or two of life. You've heard in the past that people talked about do not vaccinate in the face of maternal antibodies, but we don't know if that calf got colostrum, how much colostrum. So calves will respond to the vaccines. Blackleg and enterotoxemia are very common reasons for calves to die suddenly. And so 7-way is very, very beneficial. And if you're tagging your calves, this is a good time to give them a dose of 7-way. And then come back roughly 90 days when you're getting ready to turn the bull out. It's another good time. This is also a good time to castrate calves, work your calves, and you can start the very first vaccination if you want to at this stage. They're small enough. Castration is not going to be that terribly painful. I mean, it is painful. We're cutting them, but it will not be as hard on them as they are, when they're 5 or 6 or 7 months of age. So then we can use the virus vaccine. If they're not with the bull, we can use a modified live. If the cows are not bred and they're not with the bull, we can use that modified live. But if they are with the bull, we need to we probably need to avoid the modified live in calves, because according to the label, we're not supposed to vaccinate calves with a modified live if the cows have not received that vaccine. And the reason for that is that there's a very, 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 very slight risk that IBR that's in that modified live that's in the vaccine could actually transfer to the cow. Typically, modified live IBR causes abortion in late term pregnancies. That's when we see the problem. Usually not at the very beginning of the breeding season. If anything, that might cause a very transient infertility, but she cycles, won't breed, but then she'll breed at the next cycle. That's the only minor risk there. Then we go into we're doing the steers and the replacement heifers and the market heifers exactly the same way. And then we get to weaning, and then that's when we're adding our lepto. We've already done our replacement selection, and we've identified those heifers that we want to keep, and then they'll go into a different vaccination program. I think Handy told me that y'all talked to somebody in marketing. We want 2 modified lives in our replacement heifers. Actually, 3 is a really good idea. It's a great foundation for future immunity. And then 2 modified lives in our market cattle give us our best price. So it's the same principle. I want to make sure that I get at least 2 modified lives. Now I can wait and do that after weaning, after separating from the cows. And I just want to point out, as Handy and I were talking about some different scenarios, this is why it's important to work with somebody who knows your herd to develop a vaccination program, because some of the timing and the choices depend on your situation. And if you understand vaccines and you understand some of the risks and benefits, you can design a vaccination program that really fits your schedule and your timing. And so we don't have to be incredibly rigid. There is some flexibility. There are still some requirements for sure. But if you're working with somebody that takes the time to get to know your herd, then we can develop a very effective vaccination program, both for marketing your steers as well as for building lifetime immunity in those heifers. Now, think about this. So I've gotten this heifer, this replacement program, and I've gone through this, and now she's had 3 modified lives. So she moves from this category over here to the left into the brood cow category. Now, eventually, I'm going to replace my brood cows with heifers that have been vaccinated this way. If I've got heifers that are vaccinated like this, that have this foundation of a modified live, then moved over to the killed, science, some really good research out of Auburn says that is the best protection there is. And so I can start with a modified live, go over to a killed, annually boosted with a killed, and then I have the luxury or the ability to put all my calves on a modified live. All my calves on my herd, all my calves get a modified live. They don't get killed until they become replacement stock. Then that's when they get the killed vaccine. So be happy to go into that more, explain that later. I know we're kind of getting long tonight. And then over here on the bulls, again, pretty much the same as the cow herd. Like to vaccinate them. Some of the same things, loose mineral, multimin, pre-breeding, deworming. If they're in real good body condition, if they come off the cow herd, they're going to come off a little bit because they've been working. But you don't necessarily need to deworm. I definitely recommend deworming calves. It improves their health, and it also improves vaccine response, and it improves weight gain. So there's a lot of benefits to deworming the calves. And typically we like to see a combination. The only time that I avoid that is depending on the number of injections, right? If I've got 2 vaccines and multimin and an injectable dewormer, I'm probably going to skip either the multimin or the injectable dewormer and just stick with the oral dewormer. An oral dewormer does a really good job. It's better than any of our other dewormers. And I don't use a pour-on dewormer at all in any class of cattle. I just don't have any confidence in it. So, and the research just shows really poor response as far as a parasite knockdown. Handy, any other comments that I might have missed from our conversation earlier today?
For me, I was just trying to make it simple for me. And this here kind of gives me a roadmap that I can follow when it comes to vaccination, nutrition, and also for deworming for my herd. So if anybody would like a copy of it, I'd be willing to share it with you. But like I say, this is just a roadmap that I put together for me, and I'm willing to share it with anybody if you like. Thank you.
I like it. It's a great illustration. Thanks, Andy.
Dr. Jones, you got a sense of, as people are entering the calving season, how far away from calving should they do the body condition scores in order to understand if they should be adjusting their diet or not?
So that's a Dr. Noble, that's a really good point. It's really difficult, when you look at the nutritional requirements of cows and lactation, that's the highest nutritional requirement. So it's very difficult to change body condition score much between calving and breeding. So we definitely don't want those cows to lose any body condition. If they're losing body condition, it's going to delay them returning to heat. But if a cow can calve in a body condition score of 5 at least, and maybe a little better than that, 5.5 or 6, then she's got just a little wiggle room. If she loses a condition, she's probably going to be cycling and be able to breed back. But if she calves in a body condition score 4 or lower, and then basically that's showing an awful lot of rib and maybe some backbone, those cows breed back later. And so we're going to lose the benefit of our calving season if we don't maintain body condition. But yes, look at your cow's body condition. If the body condition tends to, and it's a little bit hard right now this time of year, right? Because we've got a winter coat on, and so they look a little fuzzier and they're a little harder to see the rib. But we might need to add some supplement, and the most important supplement is energy, either fat or carbohydrates. And so energy is going to matter a lot. Protein is good, but too much protein actually comes at an energy deficit. So we're going to want to make sure we supplement accordingly. And if we have to feed a lot of supplement, then there goes our profit. So we have to make sure we manage in body condition prior to calving is ideal. But we don't want them to lose any body condition score after calving. So yes, monitoring body condition this time of year is absolutely critical. Well, I appreciate inviting me to give the talk. I'm always willing to answer any questions anytime. Folks, if you need to get in touch with me, Dr. Whitley and Handy know how to get a hold of me. So we're here to help, right?
Yeah. Thank you.
Dr. Jones, thank you very much.